San Mateo Medical Center is a vertically integrated system of care, and the heart and soul of that system is our clinics.
The reason that we have satellite clinics within communities is so that people establish a connection and a relationship with the people who are taking care of them.
Typically, patients that come to our center are in pain. They're usually out of work, could have been out of work for a year, could have been out of work for several years.
The clinics are the most important part of our system, and they provide basic care as well as specialty care for tens of thousands of patients every year.
We're part of the community, and our staff grew up, many of them, in the community, and it's like one big happy family.
We have clinics that are out in all of the communities to make sure that we're accessible for people who need to use them.
We have been limited in what we can produce and how we can grow because of space.
We're anticipating even larger numbers of patients in a facility which is not flexible, so we've outlived our space. We don't have any room for expansion.
People have been working in conditions that have not been the best. Patients have been coming to us in conditions that have not been the best.
In my going to the clinic, I haven't felt like the clinic itself was represented the level of care.
And we do provide a very high level of care. We're very proud. We're not the last resort for people. We are actually on the cutting edge in many ways of medical care, and we do many innovative things. And it would be nice for our patients to come to a place where not only is the care of high quality, but the facility is of high quality, and they feel comfortable and welcome when they get there, and at home, basically. It's their medical home.
We have staff and patients who have been coming to us for years and years, and they've been in facilities that for one reason or another, there really are not great facilities.
For them to get a new facility, they'd finally have a facility that was able to represent the level of care that the doctors are providing at that clinic.
We're building the new clinic behind the current Fair Oaks Clinic. It's a beautiful building, much larger than what we have there now, because we're including all the patients and all the staff from 3 almost equally sized individual clinics.
They're not only trying to meet the short-term and immediate need in creative ways, but also do the long-term planning about how to expand capacity, how to expand the ability to serve in this area. And I think the consolidation of the clinics and the expansion of the dental clinic in South County is a prime example of that.
Think about dental. You can't just think about the mouth. The mouth is the gateway to the rest of your body. Patients with diabetes, patients with heart problems, in long-term care facilities, pneumonia has sometimes been a cause of poor dental health.
I wish there was more services like this available for everybody.
I envision South County Clinic with 4 dentists full-time and 5 dental assistants, a private practice for the low income and underinsured.
It's like improves everybody's lives that come through here. Even if it's just a couple of root canals to save a tooth so later on they don't need dentures.
I think the new clinic is really going to be a beautiful place, one that we've envisioned in a grand sense, but also in very specific ways that will be a place that is truly the place that our patients and our staff deserve.
We're going to beautify this neighborhood. We're going to create wonderful landscaping and put a beautiful building in the middle of the neighborhood.
From a community point of view, if we can actually have this building be available for anyone and everyone in the community and reach the patients who are unaware and who don't think they need us but could use us.
You can go to hospital and be seen in an emergency room and see a doctor and they'll sew you up or fix a broken leg, but they won't fix a broken smile.
This foundation you can build to teach our community for like a healthy environment so they can be well educated with all the information we can give them So that way we can make our community healthy and happy.
I'm very glad I live in San Mateo County where I am able to take my kids, all 3 of my kids, to such wonderful doctors.
It's important to care for everybody because we all are connected.
Our patients are generally not well off. Many of them are very poor. And here we have an opportunity to provide them with really excellent health care. And all we need is a little bit of help to do that.